Good day, everyone. Hi, I am Louie Apan from BSIE 2A, and today I'm going to facilitate this event, and it is entitled the Physical Disabilities presented by Group 1 from BSIE 2A. Today, we would like to acknowledge the presence of our subject advisor, Ma'am Samantha Policarpio, and also her apprentice, Ma'am Brenda Lee. Thank you for joining us in this discussion. And now, proceeding to our discussion, let us start this event with a formal prayer. May we call in Ma'am Angeline Arucan to lead the prayer. Thank you.
Let us bow our head and pray. In the name of the Father, and the Holy Spirit. Amen. God, we thank you for the gift of this new day. Please help us to use it for your honor and glory. By your grace, may all our thoughts, words, action, and of course our reporting in this day may be pleasing today in your sight. We ask these blessings through your Son, Jesus Christ, our Redeemer. Amen. In the name of the Father.
Amen, Ma'am. Thank you for that wonderful prayer. And now, proceeding to our discussion, let us all introduce our members of this group that made this presentation successful. And the group 1 are composed of, let's start with our technical committee. They were assigned to do the research and the editing of this presentation. Starting with Ma'am Rasheen, Faye, Alejandro. Ayan, si Ma'am Rasheen. Kaway-kaway. Ayan, thank you, Ma'am. And also, Miss Angelica Versoza. And also, headed by the, yung editor natin. Thank you, Ma'am Yoshabel Adsuara. And now, moving forward to the presentation, the presenter, or the one who is going to discuss this whole event, may we call in Ma'am Nadine Asirot. Ayan, hi, Ma'am Nadine. Also, Ma'am Angeline Arucan, and also Miss Honey Aguilar, and me, Louie Apan. Thank you. And now, let's start with our first part of the discussion: the physical disabilities. The physical disabilities, or the physically handicapped, have impairments that are temporary or permanent, such as paralysis, stiffness, or lack of motor coordination of bones, muscle, or joints. So they need special equipment or help in moving out. Ayan. Kagaya na sa picture natin, meron tayo dito, ano nakalagay dyan? Meron tayo wheelchair. And ginagamit ito lalo na ng mga badly need, yung mga hindi nakakalakad na maayos. A person with a physical disability is hindered in his capability to do activities properly, such as walking, grooming, and toileting. A person who can be physically crippled for two reasons. There are two reasons why some people are physically disabled. One is, hindi pa. Balik mo. One is congenital or the heredity na mamana. The person has been physically disabled since birth, or the condition developed later due to genetic condition, muscle cell disorder, or prenatal injury. So some of the issues were caused by some pregnant women who do drugs or drunk or smoking while conceiving. Also, there are some people who later, nung kalaunan ay nagkaroon ng karamdaman, maybe flu or something that may affect their genetics or their genes that made the deformation. And also, number 2, acquired. The physical disability was developed as a result of a car or industrial accident, an infection such as polio or disease, and disorders such as stroke or cancer. Especially in our course, this BSIE or industrial education is commonly performing a lot of equipment. So we really need to be careful, especially when working with things or with equipment which can harm us. So that's why proper PPE should properly wear. And moving forward, crippling disabilities include the following: impairment of the bone and muscle system, which affects mobility and manual dexterity, difficult and impossible as in the case of amputees and those with severe fractures. Letter B, impairment of the nerve and muscle system, making mobility awkward and uncoordinated as in cerebral palsy. And deformities, lastly, deformities or absence of body organs and systems for mobility, like in the case of the club foot and paraplegic. We all know that the bone provide the structure and form of our body. So, alam naman natin na ito yung pinaka talagang poste ng ating katawan. And they work with muscles and other connective tissues to help us move. And, syempre, it cannot work alone. Meron tayo dyan mga muscles that help us in performing activities or movement. Impairment of the bone and muscle system can impact the individual's strength, speed, endurance, and coordination. So, most of the people who experience or having this disability, talagang nahihirapan sila maglakad because of their injuries or because of their, they are incapable of performing. And also, while others may walk with the assistance of braces, canes, or walkers. So, yung iba naman daw talagang nagkakaroon ng mga gamit, mga equipment who help them move. And dexterity deficits do not always involve the legs, or some individuals may have limitations that are specific to arm, hand, or even fingers movement. So, syempre, not only in the foot or sa isang paa. Some of the issues sa kamay, sa daliri, or minsan sa braso, it really happened. Next ay yung sa next natin dito is yung impairment of the nerve and muscle system, making mobility awkward and uncoordinated in cerebral palsy. So yung CP, ayan, is a group of disorders that affect a person's ability to move and maintain balance and posture. So dito, makikita naman natin, we are all aware of cerebral palsy. They are having difficulties in speaking, in moving properly, in their position, yung paggalaw nila, they are really incapable of doing that. And it is the most commonly motor disability in childhood. Cerebral means having to do with the brain. So this one, hindi siya issue sa buto or issue sa katawan. It is the lack of our brain in sending signals to properly move. So, yung alam naman natin, and also the palsy, which means weakness or problems with developing brain that affects person's ability to control his or her muscles. So, yon pag pinagsama natin, cerebral means the brain and palsy means weakness, or in short, the weakness of our brain in sending signals to properly move. And lastly, letter C, the deformities of absence of body organs and system for mobility, like in the case of club foot and paraplegic. Club foot is a malformation in which an infant's foot is twisted inwards to the point where the bottom of the foot is facing sideways or upward. So this one, nakikita natin to, madalas na pipicture sila sa mga KMJS, or maaari most of the people really don't have any idea of this one. Pero nakikita nila to. So, dito nagkakaroon ng deformation yung buto ng mga tao. Like yung paa nila, maaaring sa halip na nakaganyan ay nakapataas, minsan nakatagilid, which makes them harder to move. And now, the foot will remain deformed if your child's club foot is not treated and he or she will be unable to walk normally. Most conditions, alaalala ko yung pinsan ko, meron siyang ganitong sakit, pero na-cure siya by therapy. So, sana hanggat bata daw ay na-distinguish or nalalaman yung ganitong kaso so that the doctors can help them. Pero mostly, lalo na sa mga may hirap na area, this is an issue. Hanggang sa tumanda na hindi na na-therapy, ayun, naging permanent na sa kanila yung karamdaman. While on the other hand, the paraplegic is the inability to move the lower half of your body. Paraplegic are people who have disability. It is a medical word for being paralyzed from the waist down. You cannot move your legs or anything below the waist if you're paraplegic, and you don't have any sensation or those areas either. Damage to the spinal cord, which can occur as a result of disease or an accident. It is commonly caused of this disorder. Wheelchairs are commonly used by paraplegics to get around. So this one, ito naman yung nakikita natin talaga na they are incapable of walking, not because of their bone issue or what, but they really can't feel or have the control over their lower part. So it is obvious na nakikita talaga natin that there are some people who really have issues on this paraplegic. Talagang they have no control. Para kumbaga yung stroke, kung yung stroke kalahating katawan maaari nakangiwi, dito naman they have parang kalahati din siya pero pababa, and they don't have control over that part of the body. And yun po. Next, to be discussed by Ma'am Nadine. Let's give her a round of applause to discuss the causes of handicap. Thank you.
Causes of handicap. A number of factors have been identified as cause of crippling handicaps, impairments, and disabilities. These are first the prenatal factors. These are factors that affect normal development before and after conception, usually lasting up to the first trimester or third trimester of life. Especially, this include the following: genetic or chromosomal aberrations. This results from the blood incompatibility of the husband and wife. There is the transfer of defective genes from parents to offspring. Genetic disorders traditionally fall into three main categories: the single gene defect, chromosomal abnormalities, and multifactorial conditions. A chromosomal abnormality or chromosomal aberration is a disorder characterized by a morphological or numerical alteration in single or multiple chromosomes, affecting autosomes, sex chromosomes, or both. Chromosomal abnormalities may also classify as constitutional or acquired. Constitutional chromosomal abnormalities arise during gametogenesis or early embryogenesis and affect all or a major portion of an organism's cells. Acquired chromosomal abnormalities typically develop during adulthood and affect a single clone of cells with a determined distribution in the body exclusively. Next is the prematurity. Birth of the fetuses is usually earlier than the 9th month of pregnancy. Premature birth occurs when a baby is born before the 37th week of pregnancy. Kids born this early may experience more health issues or require more hospitalization time than babies born later. Premature babies may require particular medical attention in an intensive care unit, also called ICU. Prematurity can affect a child's life for the rest of his or her life. A baby's health is much more likely to get affected the earlier she is born. Some of these issues may not manifest themselves for many years, even into adulthood. Early diagnosis and treatment of health concerns, as well as the prevention of premature birth, can help babies live longer and healthier lives. Next is the infection. This is caused by bacteria or viruses on the fetus in the womb of the mother. The germs usually come from highly communicable diseases like rubella and venereal diseases. Neonatal sepsis is caused by infection either directly from the mother or the outside environment, like poorly sanitized delivery rooms, infected hospital gadgets, and many others. Rubella is very dangerous for a pregnant woman and her developing baby. Infection with rubella diseases causes the most severe damage when the mother is infected early in pregnancy, especially in the first 12 weeks or first trimester. Congenital rubella syndrome or CRS is a condition that occurs in a developing baby in the womb whose mother is infected with the rubella virus. Pregnant women who contract rubella are at risk for miscarriage or stillbirth, and their developing babies are at risk for severe birth defects with devastating or lifelong consequences. Children with congenital rubella syndrome or CRS can suffer hearing impairment, eye and heart defects, and other lifelong disabilities, including autism, diabetes mellitus, and thyroid dysfunction, many of which require costly therapy, surgeries, and other expensive care. Next is the malnutrition. Insufficient intake of food nutrients is necessary to sustain the growth and development of the fetus and the mother. Maternal malnutrition can influence the baby's development, causing fatal growth delays and increasing the possibility of the infant having disabilities. Preterm delivery is related to a variety of problems and long-term implications, involving cerebral palsy, cognitive, visual, and auditory impairment. Iodine deficiency is the most common global cause of impaired cognitive development, the issue becoming much more serious if it develops during pregnancy. Iron deficiency is also popular, and it can damage the structure and function of the developing brain, resulting in cognitive and behavioral problems. Disabilities placing an individual at particularly high risk of nutritional deficiency include cerebral palsy, craniofacial anomalies, and the many genetic syndromes such as Down syndrome and Pierre-Robin syndrome, which are associated with, for example, oral motor feeding and swallowing problems. Next is the irradiation. Pertains to the exposure of the pregnant mother to radioactive elements like an X-ray. Exposure of the mother also affects the fetus. Prenatal radiation exposure is when a fetus is exposed to radiation while still in the womb. When the mother's abdomen is exposed to radiation from outside her body, this can happen. A pregnant woman who swallows or inhales radioactive materials may also absorb the chemical into her system. Radioactive compounds in the mother's blood can flow via the umbilical cord and reach the baby, or they can focus in parts of the mother's body near the womb, such as the urinary bladder, and expose the fetus to radiation. Even if the dose is too low to provide an instant impact of the mother, the health consequences of exposure at doses more than 0.5 GY can be severe depending on the stage of fetal development. Growth problems, deformities, impaired brain function, and cancer are all possible health implications.
Thank you for that wonderful discussion, Ma'am Nadine Asirot. And to move on the next part, may we call in Ma'am Angeline Arucan to discuss the metabolic disturbances.
Metabolic disturbances.
Thank you.
This is the inability of the mother or the fetus to make use of the food intake. Metabolic disturbances influence how the body consumes and transforms food into energy in babies. Some of these illnesses are dangerous. Metabolic disturbances can have a negative impact on the baby's health and development, and in severe situations, they can be fatal. Often, these disorders run in families. Infants with metabolic problems may appear healthy at birth, but later develop symptoms in the days, weeks, or months that follow. They could possibly have symptoms that aren't specified. Many metabolic diseases can be detected by doctors through newborn screening or NVS programs. These screening programs determine whether a baby is at risk for a specific condition. Diagnostic testing, on the other hand, determines whether an infant has a condition conclusively. Next is drug abuse. Drug abuse is an entry of large quantities of medicines into the body thus affecting the fetus. Thalidomide used by mothers has affected thousands of babies who were born without limbs and other extremities. Women who are pregnant or who may become pregnant while taking thalidomide should avoid taking it. If the mother or father is taking thalidomide at the beginning or during pregnancy, the baby may develop serious, life-threatening birth problems or die. Even a single dose of thalidomide can result in serious birth abnormalities in the arms and legs, bones, ears, eyes, face, and heart of the baby. Now let's move on to the second factor, causes of handicaps, which is perinatal factors. These are factors that cause crippling conditions during the period of birth. It is the period of time when you become pregnant and up to a year after giving birth. Perinatal factors include birth injuries. Birth injuries are suffered by the newborn baby. Injury to the spine will cause paralysis or kernicterus. A birth injury describes any type of injury that the baby suffers before, during, or directly after childbirth. Some birth injuries can lead to more severe complications, resulting in your child having a disability for the rest of their life. Delayed birth is one of the most common causes of birth injuries. Labors that last over 18 hours are considered delayed births. As time goes on during labor, pressure increases on the infant's brain. The compression can lead to fetal distress and high blood pressure, resulting in strokes and other cardiovascular issues. Certain medications, viral infections, and bacterial infections in the mother or infant can also lead to complications, resulting in birth injuries. Next is difficult labor. Difficult labor is hard and prolonged labor before the actual birth interrupts the oxygen intake of mother to fetus. A prolonged labor and difficult delivery place a mother at risk of serious harm, but these circumstances can also create fetal distress, which can have lasting effects on the newborn's health and development. There are a number of long-term disabilities that can result from fetal distress. While some of these conditions are immediately recognizable at birth, others may not present symptoms until weeks or even months later. The fetal distress can worsen to a point where the baby is left with long-term disabilities such as cerebral palsy, brain injury, motor impairment, visual and hearing impairments, learning disabilities, and mental health disabilities. Next is hemorrhage. Hemorrhage, profuse bleeding of the mother during birth might be caused by damage of the uterus. Heavy bleeding after the birth of your baby is known as postpartum hemorrhage. Blood pressure might decrease dramatically if you lose a lot of blood suddenly. If not treated, it can cause shock and death. The most common cause of postpartum bleeding is when the uterus does not contract enough after birth. Some infants do very well with little or no residual effects. More severe bleeds can result in mental and physical impairments such as developmental delays, learning disabilities, and cerebral palsy or CP. And the last of the factor causes of handicaps is postnatal factors. These are factors causing crippling conditions after birth. All conditions occur in the first 6 weeks after giving birth. Postnatal factors include infections. The majority of infections in babies are caused by bacteria. However, viruses can also cause infections. Bacteria can be found in the mother's birth canal, especially if she has an active infection. During labor, bacteria and viruses can enter the baby's lungs and blood through the fluid in the birth canal, which they can swallow or breathe in. During childbirth or within the first few days following birth, the newborn may become ill. The newborn baby might become ill very fast as the bacteria or viruses grow. The better the outcomes for the newborn baby, the sooner the illness is found and treated. During pregnancy and birth, a variety of bacteria and viruses can be passed from mother to newborn baby. A newborn baby can receive an infection from someone who has a cold or flu after birth.
Thanks for that wonderful discussion, Ma'am Angeline. You really did great on discussing the factors. And now, going to proceed on our next speaker. May we call in Ma'am Hani Aguilar.
Next is tumor and abscess in the brain. They destroy the brain cells connected with movement, thus impairing mobility. Tumors are abnormal tissue structures that occur when cells divide and expand faster than they should or do not die when they should. Tumors can be normal or non-cancerous or malignant or cancerous. Normal tumors can grow to be quite large, but they do not spread to surrounding tissues or other sections of the body. Malignant tumors can invade or disseminate into surrounding tissues. They can also spread through the blood and lymph systems to other regions of the body. An abscess on the brain is collection of pus that forms as a result of an infection or trauma. It is still a dangerous and perhaps fatal condition. An abscess can swell your brain, putting dangerous pressure on brain tissue. An abscess can also prevent blood from reaching certain areas of the brain. Adult men under the age of 30 are the most susceptible to brain abscesses. Children between the age of 4 and 7 are the most likely to develop them. Newborns are also vulnerable. Next is tuberculosis of the bones. TB germs are likely to attack the bones of the very young, causing crippling conditions. Tuberculosis or TB of the backbone is not common, but is still seen in poor communities, especially in children. It is the most common form of tuberculosis of the bone. It is important to recognize and treat it early before damage to the backbone causes nerve damage and paralysis. If a child begins to develop a sharp bend in the middle section of the backbone with shortening and thickening of the chest, it is probably tuberculosis of the spine. You can almost be sure it is if someone in the family has TB of the lungs. The spine collapses forward. As the spine collapses forward, the child may have to hold himself up using his arms. Next is cerebrovascular injuries. These are injuries in the head region enough to cause brain damage. Cerebrovascular disorders are a group of diseases that affect children and are normally caused by congenital abnormalities or birth defects of the arteries and veins that circulate blood throughout the brain. Due to a lack of blood flow, several of these disorders can raise the risk of hemorrhage or excessive bleeding or stroke. Cerebrovascular disease in babies and children has distinct causes than in adults. Strokes can develop in newborn babies or in the first month after birth as a result of complications that occur late in pregnancy and during delivery. Many babies have no clear cause. Congenital heart defects, sickle cell anemia, autoimmune diseases, and blood clotting issues are all risk factors for older children. Next is fractures and dislocations. These are destructions of mobility organs either through falls and other accidents causing bone fractures or dislocations. When two bones slip out of place at the joint that connects them, it's called a dislocation. A quick impact from a blow, fall, or other trauma is commonly the reason. Almost any joint in your body can be dislocated, including your ankles, knees, shoulders, hips, elbows, and mouth. You can even dislocate the joints in your fingers and toes. When a bone is forced under more pressure than it can handle, it may split or break. A fracture is defined as a break of any size, a fall, trauma, accident, direct hit, or repetitive stress, as well as a variety of medical problems that weaken bones can cause it. Next is post-seizures or post-surgical complications. These are convulsions after the delivery of the baby, which cause crippling conditions. Seizures that occur when a child has a fever, head injury, or after taking drugs often do not recur and are not considered epilepsy. Seizures have many forms and symptoms can be mild or severe. Seizures are classified according to the child's appearance or behavior during the seizure and the pattern of electrical activity in the brain, as measured by a test called electroencephalography or EEG. One of the most common seizure type is convulsion. This may be called a generalized tonic-clonic or grand mal seizure. In this type of seizure, the child loses consciousness and may stiffen and have jerking muscle movements. During the muscle stiffening, the child may bite their tongue or cheek, causing bleeding or frothing at the mouth. Other seizure types are less dramatic. Shaking movements may be isolated to one arm, leg, or part of the face. Alternatively, the child may suddenly stop responding and stare for a few seconds, sometimes with chewing motions or smacking the lips. Next is arthritis rheumatism. These are diseases affecting the spinal column and the muscles of locomotion at the back. Arthritis affects a person's overall function and mobility, which can result in activity and other limitations. It is a leading cause of work disability among adults. Rheumatoid arthritis causes joint pain and swelling, reduced mobility, and physical weakness. Rheumatoid arthritis, or RA, is a debilitating disease that can affect walking, using your hands, and other ability to manage activities of daily life, including self-care. RA can also lead to function and mobility limitations and even cause permanent disability due to bone erosion or loss of bone and joint deformity. Rheumatoid arthritis is an autoimmune inflammatory disease where the body's immune system mistakenly attacks healthy tissues. The response, called autoimmunity, causes inflammation or painful swelling that attacks the linings of joints and other tissues, including the organs throughout the body.
And now, before we end the discussion, we prepare a short video. It is a heartwarming. It is the story of physical disabilities of a person. Enjoy watching.
We need to talk about disability. You might hear people say that disability is caused by barriers in society. But what does that actually mean? Well, think about this. If someone who uses a wheelchair can't get into a building because of some steps, is the barrier caused by the person using a wheelchair or by the design of the building? If a blind person can't read the timetable for a train, what's stopping them from getting the information they need? If a child with learning difficulties is struggling in class, is it the child's responsibility to learn in the way they are taught, or the teacher's responsibility to teach in the way that the child can understand? For years, society has viewed disability as a problem that belongs to the disabled person and said that we should focus on fixing that person's impairment.
The social model of disability says that disability results from the way society is organised, rather than by a person's impairment or difference.
There is no right or wrong way to be. We are all different. We are all unique, diverse individuals.
We need to remove the barriers that stop disabled people from participating in society fully, on an equal basis with everyone else. We need to design buildings so that everyone can access them.
We need to ensure information is accessible to everyone so we can all participate in public life.
And we need to ensure that every child has the opportunity to learn and grow into the best person they can be.
When barriers are removed, disabled people can and will be equal in society,
with control over their own lives.
Not to mention all the other groups who benefit from a more inclusive and accessible society.
It's time to talk about disability differently. It's time to build our places and spaces differently. It's time to change attitudes and realise that we are all different and unique, and that an inclusive society is a better society for everyone. Authorised by Jordan Steele John, the Australian Greens, Parliament House, Canberra.
Thank you for listening and staying with us. I'd like to thank the presence of our dear speakers, Ma'am Aguilar, Hani, Ma'am Angeline Arucan, also for Ma'am Nadine Asirot, and thanks for listening, Ma'am Rasheen, Faye, Alejandro, and also our technical director. Thank you, Ma'am Yoshabel Adsuara, and your speaker, host, facilitator, I'm Louie, Apan, and we are the Group 1 from BSIE. See you again on our next video. Oh, bye-bye. Say goodbye, guys. Thank you.